got a tendency to tell you, well, this is the drug we treat that with, so we're going to stay with it. Well, what about these bad side effects?
On Medicaid, and there aren't that many doctors you can go to. It just kind of made me feel helpless.
I would imagine that that's everybody's story. I think they count on people giving up.
It breaks your heart for those who do not have the connections or the financial wherewithal, or even, first of all, even where to start.
I was a CNA for 15 years, so this is a blow to me. I was the caregiver. I never thought I would be the care receiver. He came walking into the examining room, and he looked at me, and he said, "Miss Linda," he said, "before I even start the examination," he said, "I want you to consider one of two options." And I said, "Okay." He said, "Consider a nursing home or hospice." And I looked at him, and I said, "What are you telling me?" He said, "Well, you've come down with pulmonary fibrosis." And he said, your outcome is not going to be good." My heart was on my sleeve. I was terrified. I was really frightened. Not of dying, really. I know where I'm going. I've tried to live a very good life. Just a shock, because I asked, "How much time do I have left?" And he goes, "I don't know," and walked out. I don't mean to be disrespectful to him because he's very good at his field, but I felt his skills were a little rough that day. But then, what's a nice way to tell someone they're dying?
Predictable and reliable attendance is required.
He had had a sore throat for a few days, and we tried over-the-counter meds. We, gargled with salt water. I knew it was his tonsils, but it probably wasn't serious. But he was still uncomfortable with the sore throat. Well, the doctor did the COVID test. They did the strep throat test. It all came out negative, and we left with nothing. When he's on Medicaid, and there aren't that many doctors you can go to, it just kind of made me feel helpless. What am I going to do? Do I have to go to the emergency room for this?
So once a week, gabapentin, which is for nerve pain. I'm in chronic pain all the time. Just had some kind of rash, give me some cream and I'm done. And she walked in the room and looked at it and said, "That's lupus." And I'm like, "No, it can't be. I've been tested for lupus." So she did a biopsy of the rash, and it came back positive. So that's actually how I was diagnosed. Work was kind of my identity. I just figured I'd work till I dropped. And then when this came along, it was difficult because financially, and then just psychologically, just trying to figure out who I am without work. It took me 3 years to get it with an attorney. So those 3 years were probably the worst 3 years of my life. That was the hardest part, was getting through, navigating that system. I would imagine that that's everybody's story. I don't think that you're just gonna get that process quickly. I think they count on people giving up or dying.
I adopted my daughter 11 years ago. There was no medical history. I had to start the whole process from scratch. It's just that automatic stigma of, oh, hey, you have this card, so you must be X, Y, and Z. Or you come from X, Y, and Z side of town. It's very heartbreaking. And I've learned that over the years, just in my daughter's experience, just the looks that you get from having Medicaid or presenting your Medicaid card to the counter at a doctor's office. You get the look from a staff member or from somebody in the waiting room. It's very frustrating. It's very heartbreaking that we put labels, especially when it comes to healthcare. Being in the medical profession, 20 years now, gave me a little advantage because I knew people. I had some connections. It breaks your heart for those who do not have the connections, who don't have the resources or the financial wherewithal. I just wish our healthcare system offered more than what it does, than to those who could afford the care.